Hi, I'm Adrienne Standley. I'm a member of Philadelphia United for Progress, which is also known as Philly Up. I am not a healthcare policy expert, but I've become somewhat of a healthcare nerd over the past few months. I think one of the most important parts about the fight for affordable, accessible healthcare is education. So I'm here presenting this information as I learned it in hopes of educating and starting conversation. So this is going to be a little bit about Medicaid, the threats to Medicaid that we might see in the current administration, and how you can help. So a little overview on what we have now for our Medicaid system. Medicaid is a federal government program to help provide healthcare coverage to certain categories of people who have low income and few assets. So each state's Medicaid covers basic healthcare, but some states may have extensions on their Medicaid and may run their own version of Medicaid with slightly different rules and coverage. Traditional Medicaid, as we have it now, has been a program that's been running for about 50 years. Traditional Medicaid covers, for the most part, seniors, children, persons with disabilities, and pregnant women. In Pennsylvania, we have 2.2 million people covered by Medicaid, and about half of those are children, about 1.2 million people. CHIP is another program that covers about 170,000 children. Medicaid is jointly funded by the states and the federal government. So the federal government pays states for a specific percentage of program expenditures, which is known as FMAP, which varies by state based on criteria such as per capita income. In Pennsylvania, the cost for Medicaid is split pretty much between the states and the federal government, about 50-50. Essentially, with Medicaid as we have it now, patients seek care, the state bundles all of those costs together, and then pays for the care covered. The federal government then reimburses a percentage of the cost, in Pennsylvania 51.6%. The state and the federal governments have essentially committed to each paying their share of the cost for as much care as needed by every person who qualifies for Medicaid. Coverage is guaranteed for everybody eligible. Federal funding increases based on medical inflation. Medicaid expansion is a fairly new program that rolled out with the Affordable Care Act. It's an option for states to expand coverage to more low-income citizens. These are mostly folks hovering around the federal poverty line. About 50% of them are currently able to work. This was designed to cover poor working families in what we call the Medicaid coverage gap. This program is the most cost-effective for states. States receive a high match on their expenses from the federal government paying about 90% of these costs. The last thing to know about Medicaid expansion is it was offered through the Affordable Care Act, but not all states opted into the program. So Pennsylvania is the state that chose to take advantage of this program. So traditional Medicaid covering seniors, children, persons with disabilities, and pregnant women, funding being split between states and federal government. Medicaid expansion is that extra program that's covering just low-income adults. It's funded 90% by our federal government. Medicaid expansion provides a really good deal for the states and is kind of the closest thing we've seen in a step towards a single-payer direction. So these programs are expensive for the federal government, but they're so very worth it. They pay off. Preventative care has been shown to lower the costs in the long run of healthcare. These programs prevent overuse and overburden of our emergency room systems, and they keep people healthier in the long run. Our current administration is seeking to make drastic cuts to these programs, which may happen in a few different ways that I'm going to outline in the next slides. So a few ways, and it's kind of a bulky slide, but this tells you a few different ways in which Medicaid and expansions have helped our citizens in Pennsylvania and across this nation. About 18% of Pennsylvania's population gets coverage through Medicaid. And we've also been able to drop the uninsured population from 15% 4 years ago down to 6% right now. Medicaid helps pay for senior residents to remain in home care rather than being pushed into nursing homes. Medicaid expansion helped to close that coverage gap, bringing coverage to hundreds of thousands of citizens in Pennsylvania who didn't already have coverage. Both programs provide for preventative and long-term care, which is shown to improve overall health. Medicaid expansion is particularly important for those who are using substance abuse programs. Approximately 20% of Medicaid expansion enrollees rely on the programs for substance abuse treatment. So the Department of Health has estimated that because of this, our hospitalizations of uninsured people have dropped by 75% with Medicaid expansion. Medicaid programs also help pay for low-cost care centers, which are particularly valuable in rural areas. So there's a couple ways that our government could seek to change the funding structure of how Medicaid works. Two of these that are most likely to be seen are block grants or per capita caps. Both of these structures are ways for federal government to back away from its commitment to providing care for its citizens. Block grants are basically an allowance. So the federal government says, I'm going to give you this fixed amount per year per state. It decides that ahead of time on a funding model, and the amount that each state gets per year increases on a fixed formula. So it's the federal government basically deciding how much of an allowance they're going to give the states, and there's no flexibility in that. So once you've gotten that money, if you run out of it, there is no more until the next year. Per capita caps are a very similar idea. Instead of giving an allowance to the state as a whole, they're giving an allowance per person who's enrolled in the program. Of course, this means that as costs go up, we're still stuck with that predetermined allowance. Both of these programs mean huge cuts in funding. This also allows states a little bit more flexibility than our traditional Medicaid program so that they can cut benefits, coverage, eligibility, and corners. So, some issues with the two. They both have their issues. A lot of the issues are very similar. Both plans are capped at low fixed rates. The issue with that is that medical inflation increases year to year at a much higher rate than our standard inflation, which is what these fixed rates are based on. So medical inflation tends to go up due to new discoveries, costs, and enrollment fluctuations. So if we aren't increasing the amount given to states year by year by the right amount, by that medical inflation rate, our funding for our states will never catch up to the rising costs. Each year we're going to fall further and further behind. Both plans lose any flexibility to account for economic troubles or fluctuations in the country or in the state. So block grants and per capita caps are both extremely inflexible. Block grants, being an allowance given to the state, allows the state to pretty much do what it wants with that money as long as it's putting it towards quote-unquote healthcare. So some states have used these for pet projects, for example, things like a pregnancy crisis center, which rather than working like a Planned Parenthood, gives incorrect or biased information and can push religious agendas, but is considered still a healthcare service. With per capita caps, we can see even bigger cuts to funding than block granting. And funding in either of these does not increase as new medical advancements are made or enrollment fluctuates or grows. So if we have an economic downturn in the country, people aren't as likely, aren't able to get care through maybe their employer or through the ACA, and they fall under that Medicaid grant money. The fixed amount that's given to the states does not fluctuate to allow for extra people to come onto that program. So right now with Medicaid, 10 essential healthcare benefits are protected. Things like maternity care, things like healthcare parity, meaning that mental health is treated exactly the same as physical health. With block granting or using per capita caps, the states then have the ability to turn off those 10 essential healthcare benefits. So they can say, this year we didn't get enough money to cover everybody, so we'll pull back funding on a certain group or a certain group of people. So they can cut funding from certain programs depending on how much money they want to save. So I have an example of funding shortfalls. This one is through something that would be a block grant situation. So in the first year you implement block grants. Say, for example, that you have 4 people on your program. You have 4 people in your state. The federal government says, okay, for these 4 people, we're going to give you $100. So in year 1, you have $25 to spend per person. So say the next year, inflation has gone up by 3%. However, medical inflation, which remember rises at a much higher cost, has gone up by 7%. But the government's giving you your money based on regular inflation. So last year you got $100, this year you get $103. But you also have extra people that moved into your state. So you now have 5 people on your program. So the government's saying, okay, we'll give you $103. We gave you that money to make up for inflation. Use that for your 5 people. So now you only have $20.60 to spend per person. However, with medical inflation, each person needs $26.75 to maintain the same level of care that they had on their previous plan. So you see very quickly, year by year, that money kind of starts to fall off, and states are going to be struggling to make up the difference or cut people from their programs. So if we see these drastic cuts to Medicaid funding, there's a few things that you can do. You can sign up for rapid alerts from Pennsylvania Health Access Network. please, please, please contact your member of Congress and talk to them about the issues. Telling them personal stories is always very impactful. You can share your personal story online with Pennsylvania Health Access Network at insurepa.org. Writing letters to the editor or op-eds. You can also sign up for field calls and webinars through Pennsylvania Health Access Network. So these are your next steps when it comes to taking a step beyond contacting your representative. So if you want to get involved in boots on the ground action. You can also shoot me an email with any ideas if you have ideas that you want to put forward in Philadelphia, or if you have any questions, my email is up on the screen. These are some of my favorite resources and some of the places where I've learned the most. Pennsylvania Health Access Network, Community Catalyst, the Kaiser Family Foundation, and the Healthcare Defenders Coalition. Thank you so much for your time, and let me know and reach out if you have any questions.